Well, my teeth were infected, and I found Dr. Gasser through an ad in one of the local papers, and I came in to see him. Well, he put 8 implants in my bottom, and I'm going to have 8 more on the top. It's just amazing. I smile a lot more. When everybody just compliments me on the good work that Dr. Gasser did on my mouth. I can eat almost anything, candy or whatever, before it was just kind of chewing your food and swallowing it. Oh, I would highly recommend dental implants over false teeth any day, because the false teeth slop around in your mouth, and it's with the implants, they're your own teeth. You don't have to be pulling them out. I think Dr. Gasser is one of the best dentists that I have ever been to. Even when he's shot Novocaine in my mouth, he massaged the gums, and it was absolutely painless. I don't feel that I had much pain at all, and I said I'd go through it again if I have to.
Well, it is like my own teeth, yeah. And after a while, I thought, uh-oh, there's a difference between the lower and the upper, so we better do a little something about the lower. So that's how come that didn't get done. Well, no, I'm very, very happy with what was done, and I'm so glad I did it. So it just feels better. Oh, he's a good doctor. I think he's great. I've been coming here for a long time. Actually, before he opened, before he bought it, I was coming here. So I've been here for, I can't even tell you how many years. It's been a long time.
This is one of our typical patients. This is Betty Marotti, one of our favorites, and she has a tremendous story. She's very happy with her implants, and the background of why she came is very, very interesting. It's one thing for me to talk about implants, it's another for a personal story that changed your life, didn't it, Betty?
Yes, it did.
Tell us a little bit about what happened to you and what implants have done for you since then.
Okay. I don't know if you remember that I lost my teeth.
I do remember, Betty. Yeah.
That was really funny.
How did that happen?
Well, a friend of mine and I went to the movies, and my teeth were bothering me. I had a soda and a popcorn.
How were they bothering you? Were they irritating, loose?
Loose in my mouth. I've had my dentures for 40 years. So since then, I need new teeth. And
right.
Now you're talking to me about the implants, and I never heard of them before. But now that I've got them, I love them. They are great.
What were some of your concerns about dental implants?
I was afraid that it would be very painful. I don't like
the dentist
in my mouth and dentists, although I like you and the ladies that work here are wonderful.
Right.
I thought the implants would be cold weather hitting them, ice cream, things like that.
So you eat better?
Yes. Before I got the implants, I was avoiding eating a lot of foods because it would hurt to start eating something and my bottom dentures would start moving around. And the food would go underneath and all these things. So
right.
I wouldn't eat a lot of things, and especially if you go out in public at a restaurant and you don't want to be sitting there trying to eat and your dentures are moving around in your face. And
right.
so you do avoid a lot of eating different things, and now I can eat steak, I can eat everything just fine, and I'm really enjoying them. It's not a problem to take my dentures out, and I brush them and I put them back in, and they're very comfortable. I just don't have a problem. They don't move around, which is almost a miracle from what I've been living with for
Right.
20 years.
Right.
I really think that everybody that has a problem with their teeth should come and find out about the implants. They're very good for you if you have one implant or the whole dentures. When they first talked to me about implants, I thought they were crazy. I'm like, what in the world? You know, I just couldn't imagine doing anything like that. But I'm telling you, it's worth every penny that you can be comfortable with eating foods. I can go places. The people I work with are saying that when they take a picture of me, it takes such a good picture now because I have such a nice smile.
You know, Betty's situation is very common, very similar to what we hear from many different people. And I might add some information that she really didn't reveal to you. She had dentures for 40 years. And during that period of time, she experienced a progressive loss in terms of comfort and function, and also progressive loss of bone support. Isn't that right, Betty?
Yes.
And when you lose bone support, you end up with premature aging in the appearance. So over a long period of time, a lot of folks think, this is it. This is all I can do. This is as good as it gets. But actually, many denture patients kind of forget, Betty, how it is to chew. Isn't that right? So now you kind of remember what it's like now that you have dental implants and they're snapped in place. You can chew like you used to. So for folks that have had dentures for a long period of time, they shouldn't give up, right? They
Right.
may be candidates for dental implants no matter how long they've had dentures and no matter how difficult it is for them.